Hi, I'm Dr. Sarah Delatorre. I'm one of the physician providers at SRM. And Haley Baker is one of our fabulous nurse practitioners. And we're really excited to present part of our PCOS webinar series. And we're going to be focusing on lifestyle factors specific to exercise and sleep, which are really important for everybody, but particularly important, I think, for patients with PCOS. So I'm going to hand it off to Haley, and she's going to cover some of it, and I'll cover the rest.
Hi, everyone. Thanks for the great introduction, Dr. De La Torre. Like Dr. De La Torre said, my name is Haley Baker, and I'm one of the nurse practitioners here at Seattle Reproductive Medicine. I am part of the PCOS Wellness Program and do see patients with PCOS. I mostly work in the Bellevue and Kirkland locations, but I do see patients very commonly in the Seattle office as well. I personally am very passionate about PCOS. I was very lucky to go and attend our PCOS Advocacy Day this year at the Capitol and have a personal interest in just health and wellness overall. I'm currently working on my doctorate of nursing in specific health and wellness and include PCOS patients in my project. So I'm so excited to go ahead and talk about overall exercise, lifestyle, including sleep for women with PCOS. So there are so many benefits of movement and fitness for women, especially women with PCOS. And it's really important to remember that there are benefits of exercise regardless of weight loss or physical change in your appearance. Regular movement can help decrease insulin resistance, which is crucial for women with PCOS. That does help regulate ovulation and helps decrease later risk for diabetes. It helps maintain a healthy body weight. And also it's very good for the mood. It really can create and build relationships and social activities if done with friends and family. And importantly, it can create a healthy habit or baseline, especially for future pregnancy. According to the American Heart Association, they've set updated guidelines for the number of minutes that you should shoot to exercise in for each week. They recommend that to maintain a healthy weight, you shoot for about 150 minutes, which is about 2.5 hours of moderate intensity exercise, or about 75 minutes of high vigorous intensity exercise. On the next slide, we'll talk a little bit about how to define moderate versus vigorous. And they also recommend adding in about 2 days per week of muscle strengthening or weight training. In order for modest or healthy weight loss, they recommend about 4 hours a week of moderate intensity or about 2.5 hours of vigorous high intensity exercise. They also recommend adding in those 2 days of weight training per week. It's sometimes difficult to know exactly what we mean by mild, moderate, or vigorous. So a few ways to just think about it. Mild intensity exercise would be where you can walk and talk easily. So imagine you are going out for a walk with a girlfriend. You guys are able to catch up about everything in life, and you're not really out of breath. Moderate intensity would be you can still talk, but you might be a little bit breathy. It might be a little bit hard to have a very detailed conversation, and you definitely could not sing a song. Vigorous activity is you can't easily talk, you're breathy or breathless, definitely are not talking or singing. Many people wonder, especially for all women, but definitely for women with PCOS, what is the best type of exercise to help the parameters that we specifically need to address with PCOS? So blood sugar and insulin resistance, healthy weight, and also mood symptoms. Although there are still limited studies and we need more research specifically on types of exercise for PCOS, limited studies do favor high intensity interval training, also known as HIIT training, which you may have heard of, versus low intensity steady state training. Just to give you a few examples, HIIT training would be circuit-like trainings. Usually it's pushing your hardest effort, becoming out of breath, getting your heart rate high for a short duration, often usually 30 seconds to about 2 minutes, and then giving your body a break to then recover in heart rate. And then low intensity could be something like walking, maybe the elliptical, light jogging, things that are still aerobic, so you're getting enough oxygen. They found that HIIT, when done truly at maximum effort, it is very effective at using up your glucose stores really quickly and triggering production of insulin to then transport the glucose back into the cells. So this really helps decrease your resting blood sugar and it helps improve insulin resistance. They've also found that HIIT training is the most effective for what they call EPOC, or excess post-exercise oxygen consumption. That's basically just a fancy way of saying that it's most effective for for increasing the calories you burn after exercise, also known as the afterburn effect. We also know that HIIT training can be really effective, especially if you're on a busy schedule, because usually HIIT workouts are no more than 20 to 45 minutes if done truly at maximum effort. Also, we know that strength training or resistance training is also very crucial, especially for women with PCOS. We found, or research has shown, that muscle contraction increases glucose uptake, and they've also found that with a 10% increase in muscle mass, especially for women, there's an 11% reduction of risk for insulin resistance. They found that strength training can decrease androgens, which is your testosterone levels, which we find that are elevated with many women with PCOS. And they find that when women have more muscle mass, they have a higher resting metabolism. Many women are very nervous about bulking up, or feeling like if they do too heavy of weights or too many weight days versus cardio, they're going to get too muscular or bodybuilder-like. Especially when people have higher levels of testosterone, like in PCOS, they might be extra nervous. However, it's so important to remember that when we see those women that are bodybuilder, really, really muscular, they're often following very high protein, regulated, controlled diets, and usually taking workout performance supplements or enhancements. So strength training is not necessarily going to bulk you up, or it should be anything to be afraid of. Just a few tips for exercise. You can read over these later, but we do recommend investing in quality footwear and clothing. And very importantly, to increase your amount and intensity gradually. You definitely want to start these programs very gradually and work your way up, increasing in the time, the amount of minutes, and also the number of days per week. Even if you're feeling like you're really motivated, it is really crucial to take about 1 to 2 rest days a week for best recovery. And you'll most likely find that after your rest days, you have a more effective workout anyways, because your body just needs and benefits from that rest. It's important to always modify and to try to never quit an exercise. And do know that conflicts are natural and will arise, but do your best to keep to a schedule. A few exercise tips is we really have come a long way in the last year, especially with the pandemic. We now have very many virtual options. We have great online resources, and it can be really helpful and give you more creative options to use different apps, websites, and different logs online. And one thing that will help keep exercise and healthy movement sustainable and healthy is to focus on your lifestyle and your mood, and not just the number on the scale. And also to involve your friends and family or your community. Now it's getting nicer, it's beautiful, sunny, we all want to be outside anyways, so try to involve your friends and family. I think one thing that many women with PCOS get sick of hearing from their providers, and unfortunately hear a lot, is that the only solution for PCOS is to lose weight. And unfortunately, we start to develop a lot of negative tones to these statements, like you need to eat less, exercise more, and lose weight. But we do need to shift our focus into more smart and positive goals that are better for the long-term and sustainable actions. We encourage you to fuel smartly, so to use food as fuel to power your movement and your needs throughout the day, to move with purpose and to do things that you enjoy that also can have a good effect on your body, and to work to improve your health, not just to lose weight. So another very important component to lifestyle is restorative sleep. And unfortunately, we do find that women with PCOS do have an increased risk of sleep disturbances. Research still needs to be done on exactly why this is, but we do know that women with PCOS actually are about 30% more likely to have obstructive sleep apnea, and this is likely related to a higher BMI, high testosterone levels, and low progesterone from not ovulating regularly. We also know that sleep apnea is related to insulin resistance, although the exact relationship is still a little bit unclear. We do know that inadequate sleep and low quality sleep can increase the risk of diabetes further and cardiovascular disease. and it can negatively impact how you feel throughout the day. A lot of us know that when you don't sleep well, you can have increased cravings, especially cravings for carbohydrates or unhealthy type foods, comfort foods. It can impact your mood and your energy levels, and often depend and also really affect whether or not you're able to do your healthy movement throughout the day. Sleep apnea and PCOS, we wanted to give you some risk factor questions, both to screen yourself, to ask yourself, and also to help screen your patients for any providers that are listening. The first question is about snoring. So do you snore loudly, specifically louder to be heard through a closed door or louder than talking? Tired, do you often feel tired, fatigued, or sleepy during the day? Observed, has anyone observed you stop breathing during your sleep? A lot of times this will sound like someone is having a rhythmic pattern of loud snoring. They will stop, dramatic pause, sometimes cough, and then either wake themselves up or not wake up and just continue to snore. So a partner or friends or family, it's very crucial to have someone observe you while you sleep. Blood pressure, do you have high blood pressure? Are you being treated for blood pressure with medications? Is your BMI 35 or greater? And is your neck circumference greater than 40 centimeters or 16 inches? If you yourself have any of these risk factors, or you have a provider or a patient that you're concerned about having these risk factors, the good news is we have really great options for better screening, diagnosis, and management of sleep apnea. The first step would be a sleep study, and these are covered by most insurance plans. And the next would be a CPAP machine if you do indeed test positive. CPAPs have come a long ways as well. They're usually very well covered by your insurance. And also they have many different devices and styles that you can adjust to. Just a few tips to help improve quality sleep. We do recommend the classic recommendation of setting a sleep routine or sleep hygiene. Sometimes just having more of a schedule and a structure to your nighttime routine can be very relaxing and helpful for people. To set bedtime reminders, especially if you do have an early alarm clock set for work or other responsibilities, counting backwards 8 to 9 hours to make sure that you're getting enough sleep, and then setting your bedtime reminder can be very helpful. Decreasing screen time or light stimulus, bright lights, especially right before bed. Yes, that does mean scrolling through your phone or social media right before bed. Avoid late night meals or snacking, which can trigger your GI upset and maybe not even register to you, but your body is struggling to digest. And also decreasing sugar or alcohol, which can increase night awakenings. So now Sarah's going to go over a few supplement ideas that can be safe and effective for women with sleep disturbances.
Great. Thanks, Haley. So there are options for women to take sleep supplements. And I think what's really important is to consider the sleep hygiene stuff first that Haley just went over, creating a routine, getting quiet before bed, watching light. But if that's still not enough, there are supplements. Melatonin is a very common one that people are aware of that can help with sleep and can decrease the latency, meaning the time period from the time that takes you to go to sleep. Doesn't necessarily keep you asleep all night, but it can be helpful. Most people tend to go big on these doses, and I would just encourage you to start with a lower dose, somewhere between 2 and 3 milligrams first, and then build up as you see the effects if they're not working. I rarely recommend 10 milligrams for most patients, but again, it's sort of a trial and error, and but it's starting with the lower dose is better. Magnesium is a fabulous mineral for all of us, and most of us are low in magnesium, women in particular. Magnesium can help with headaches, it helps with anxiety, it helps with sleep, and so I encourage patients to take a supplement of magnesium during the day, but it can also definitely help with sleep at night. There's many different forms of magnesium. Some are better absorbed than others. I would avoid magnesium oxide because it's not very well absorbed. Magnesium citrate tends to be very bowel activating, so if you err on the side of constipation, citrate would work great. I prefer magnesium glycinate because it has less bowel activity, it helps with glucose regulation as well, and it has all the calming effect that all the magnesiums do. Starting with 320 milligrams is a great place, and you can always double that if needed. GABA is an interesting component that our body produces, and it's also a calming, I guess you would call it, it's an amino acid. It's also a calming amino acid. People do respond differently to it, so I would, with all of these supplements, only try one at a time and give it sort of a week trial period before adding one or changing. GABA, again, is very calming. You usually find it with other sleep help. So it can be found in tonics or other calming, so-called calming powders. That's another one to try. We don't recommend GABA be used if patients are undergoing IVF treatment, just because there's not enough data on it. Valerian root and passion flower, these typically come in teas and also sleep tonics. Places like Pharmaca or Whole Foods or other health food stores carry these tonics. They're somewhat, I would say, very benign, and they work very well. They're very calming, and that would be a nice place to start before the ones that I've mentioned before. Magnesium, valerian root, passion flower can all be used together. L-theanine is an amino acid that is found in tea, and it's a wonderful anti-anxiety and calming amino acid. It does not make you sleepy, which is great because you can use it during the day. It's an over-the-counter supplement, as all of these are. The one thing to consider is to start with 100 milligrams and then go up from there, but you will notice that it allows you to stay focused but calm, and so it may be something that you can use during the day and again at night to reduce all the thoughts that we can have before we go to bed or if we wake up in the middle of the night. And then again, the special considerations, I don't usually recommend that patients continue melatonin in pregnancy. There's just not enough data about the fetus effect. Their pineal gland where melatonin is produced and how much it would affect that. So I usually recommend no melatonin in pregnancy. And then again, no GABA with IVF planning. Theanine, I believe, is likely safe in pregnancy, but again, with so many of these supplements, there's not enough data. So I would typically recommend stopping theanine in pregnancy. However, magnesium is very safe in pregnancy and also helps a lot with bowel issues in pregnancy.
Great. Thank you so much, Sarah. I know sometimes I get so overwhelmed with supplements, so that was so helpful.
Yeah.
So to leave you just with our last connection, I think exercise and sleep are so closely related. I think regular exercise routines really help improve quality sleep, and also sleep provides the energy to accomplish your goals. One thing that many people wonder is, what is the best time to exercise during the day? And I think really it depends on your schedule, your individual preferences, maybe whether or not you're a morning person or a night owl, whatever you feel is best for you. I did find a nice quote here listed by the medical director at Johns Hopkins Center for Sleep. And truly, you should just listen to your body and see how well you sleep in response to what time you work out. So for everyone, it can be very different. Some people feel energized after a workout and can't fall asleep. Some people are exhausted and it puts them right to sleep. So really, I think just your own personal preferences. I also want to end by saying we didn't talk a whole lot about some of the more low impact exercises such as yoga, Pilates, just because there hasn't been a lot of research on the metabolic and insulin parameters that we like to focus on for PCOS specifically. But I do strongly believe personally and professionally that adding in yoga can be a very wonderful component to stress, to lifestyle, and also your sleep. So although sometimes HIIT training may give us more blood sugar improvement, I do think that lower intensity exercises like yoga, meditation, Tai Chi, Pilates, those can also be a great thing to add into your exercise routine.
I think, Haley, along with that, it's good to think about for our patients and for us personally, is that a combination of these exercises, right? So doing HIIT workouts 3 times a week and then doing yoga or Pilates or walking on the other days. It's just this daily movement is so important for all of us, especially with the pandemic. We haven't been doing this much. So I think that's
it makes it more fun to add variety. And
right.
I think as things continue to open up, I hope that we have more in-person group activities, but doing things with groups, trying out new workouts with friends and family can be really, really helpful to discover what you really like and what works well for you individually.
Yeah, absolutely.
So we'd love to open up to questions, and I do believe we have some in our chat here. I'm going to go ahead and stop sharing my screen.
What I noticed, one someone commented that when we were talking about how doctors or medical providers will say, well, just, eat less and lose weight. And that one of our participants was told that, and it is hurtful. And it's, I think, equally as important as hurtful, it's not helpful in terms of, well, how do I do that? And it's important to emphasize to patients with PCOS that it is a bit more difficult to lose weight. And so thinking about it, I encourage my patients to think about it as lifestyle changes just for improved health, and maybe to not pay attention to the scale and not weigh ourselves, because it's such a it can be such a black and white failure success paradigm, instead of thinking, how am I feeding my body? How am I moving? How am I taking care of myself? And then that, even without weight loss, can definitely help our insulin resistance and help us ovulate and things like that.
Exactly. We do still have some time. If anyone has any further questions, feel free to respond on the chat box. We'd love to see if you have any follow-up questions. I did see a comment that we will be having access to the previous sections on nutrition as well, because I do think that nutrition obviously plays greatly into lifestyle, both your movement routines and your sleep. And we will be receiving recordings of this session. You can also reach out for previous recordings as well.
So a question about where to get supplements from. So it's good to be a supplement snob, is how I would say this, is that I would not buy my supplements at regular drugstores. I think looking for supplements that are third-party tested and certified, the initials on the back of NSF are very important. I could list a lot of brands for you, but I don't want to promote one brand or another, but really making sure that you're getting high quality, third-party tested, because that means what is in the supplement is what they're listing in the supplement is actually in the supplement. That's very important. They tend to be a little bit more expensive, but I think it's worth it because you're getting what they say is in it. I'm not a big Amazon buyer of supplements, because unless they're coming direct from the company, because again, going through a third-party vendor makes me a little bit nervous about have they been properly stored and all of that. So that would be my answer. And yes, the initials are N as in Nancy, S as in Sam, F as in Frank. And it's just really important to look for third-party certified supplements. Ashwagandha. Yes, I am familiar with ashwagandha. I'm glad that ashwagandha is working for you. Ashwagandha is a support for our adrenal glands. It's kind of for stress support. It helps support our cortisol levels and manage stress. I think it's a great supplement. Again, talking with someone about it, a naturopath or an MD who's well versed in it, is a good idea, because if you're taking a bunch of different things, then sometimes they can counteract each other. But in general, ashwagandha is great for stress management, and maybe it's helping you relax. So hopefully that's a helpful answer. Melatonin, yes, it's safe to take melatonin every night. Older people, meaning aged people, really are low in melatonin, and so they are sort of supplementing and replacing their melatonin. There's debate about whether melatonin is addictive, and I tend to think of that as, if our melatonin is low, then yeah, we are going to get addicted to a supplement because we're getting back to the normal level. So I think it is safe to take it every night. Let's see what else.
I'll jump in. One question about the inflammation with exercise and heavy cardio being inflammatory to the body. I would say I definitely have heard, some research on that as well. I would say a lot of times the benefits of regular exercise can be kind of outweigh what our knowledge is of the inflammatory response on the body. I do think adding in the rest days are crucial, and also really listening to your body. So pushing your body too hard and can definitely lead to worse, adverse stress response on your body. And also not giving enough recovery days for your body to fully repair. I'd love to get your thoughts further, Sarah, on kind of the inflammatory process.
Yeah, I agree. I think the idea is inflammatory, but also stress. And so stressing our bodies it's good to stress our bodies intermittently. And there's lots of good data on that improving our health and lifespan and well-being. I tend to be of the camp that thinks doing high intensity exercise as your body is able. And so it all depends on your level of where you are in terms of exercise tolerance. So if a person is pushing it so hard that they're exhausted for the rest of the day, or feeling more inflamed, or feeling struggled or exhausted, then that's too much exercise. So I would encourage you to sort of build up and see where that level is, because as you work out more, it's going to take more to push your body to that level. I, I, it's hard because every patient, I believe, is individual and their biochemistry is individual. But I would say that yes, moderate to vigorous exercise 3 days a week is probably very beneficial for PCOS patients, but not every day. I don't think it's beneficial for anybody any day, and then also for PCOS in particular. So hopefully that wasn't too ambivalent of an answer, but yeah, I think that pushing it is important to get the insulin resistance component. We're not going to affect insulin resistance with walking and yoga. It's it can help, but it's just going to take a lot longer. And so I think even if you walked 5 days a week, and then 2 of those days intermittently you did high intensity, or one day just trying to get that high intensity, and maybe that's just walking hills, right? You're just pushing it during the walk. It's just sort of looking at it from that direction. Someone has a thin PCOS patient and suspects she may have hypothalamic amenorrhea. So for our patients, this is more of a technical question, but yes, I have seen that. I'm sure most of our providers have. It's a little bit trickier to deal with, and I think calling one of us for a consult might be helpful. But yes, I have seen PCOS patients with low FSH and low LH. And absolutely, naturopath, MD, DO, ARNP, everybody can be qualified. I think it all depends on your level of training and interest in this area. I'm a board certified OBGYN and lifestyle medicine certified doctor, and I'm also functional medicine certified. So I've done a lot of training in these areas because I prefer to approach my patients with kind of a holistic approach. But any qualified health provider does not have to be an MD or naturopath or a DO, nurse practitioner, whoever has a strong interest and good training background in it. Any other ones? Did we miss any? Doesn't look like it. Well, hopefully that was helpful to everyone. Yeah.
And I just really want to once again say that we have a wonderful PCOS wellness program here at Seattle Reproductive Medicine. It's run right now by our nurse practitioners, and we have NPs in all of our office locations that see patients. Right now, these appointments are virtual due to the current pandemic, and I think this is helpful for patients because it can really fit into your schedule. We often schedule these visits for 60 to 90 minutes, so you get very detailed goal setting, information on diagnosis, and also management, which a lot of people don't necessarily always get to have that time with the provider. So we love this program, and we would love to see more patients.
Yeah, that's great. Thanks everyone for joining, and I hope you have a good afternoon.
Take care.